Okay. Good morning, everybody. We'll go ahead and get started. This is the 8th year that we've been running this conference, and very, very pleased this year to be doing it in partnership with ISMIX. You're in the Texas Medical Center, the largest medical center in the world, and this is actually not even an up-to-date picture. You'll see on the other side of this building that you're in, there's a large heart center going up, which will be our new heart center that we will move into next year. But it really is an astonishing complex of hospitals. There's lots of data about the Texas Medical Center, but one very interesting fact, and this is about 2-3 years old, there's about 106,000 people, it's more like 130,000 people that commute into work here every day. So if you don't come at the right time, you will hit some serious traffic. Two giants, of course, that everybody is familiar with, Dr. DeBakey and Dr. Cooley, both of whom have sadly passed away. Dr. Cooley more recently. They were at loggerheads and adversaries, bluntly, for most of their careers, but towards the end, before Dr. DeBakey passed away, there was a rapprochement, and they really became friends. So that was a good thing. And Dr. Cooley's initial reaction to minimally invasive cardiac surgery was, it's a stunt. They took something awfully simple, he said, this was in 1999, and they made it simply awful. Now, of course, we know that it is not the strongest of the species that survives or the most intelligent. It's the one that is most adaptable to change. And our CT residents and fellows, many of whom are here, and there will be more later in the day, are acutely aware of this, because there's a lot of change happening in cardiac surgery right now, and I don't think that they're being taught the tools for change as well as they could be in the training programs, for good reasons. Because when you're training as a CT resident, you really need to learn the basics, the grounding of your specialty, and it takes 2-3 more years to learn that. So there really isn't an opportunity to learn the kind of things that we will attempt to teach at this conference today, or at least introduce people to at this conference today in their training programs. So why re-evolution? Well, evolution happens with external influences, it's out of your control, and it happens slowly over millennia. A revolution, and many people say your revolution meeting, it's not a revolution, it's re-evolution. A revolution is a seismic event. It's a dramatic change. This is a well-known painting of the French Revolution. And so re-evolution is self-directed change. It's physical, mental, and it's gradual. And you have to do it to avoid extinction. And so that's why it's called re-evolving. We have a faculty roster which is the best of the best. I'm sure all of you know this by looking at the program. This is our second year in partnership with ISMIX, and the first year that ISMIX basically constitutes the program committee. We have attendees from all over the world, and we have several cardiothoracic fellows, mostly from the US, but also from Canada. We also have a perfusion track, which is running in parallel to this conference, and you'll see some of those folks as well. Johannes Bonatti, who is the president of ISMIX, will be giving you a short welcome in a moment. And I had the opportunity to visit Johannes at the Cleveland Clinic in Abu Dhabi just a few weeks ago. It really is an amazing facility with an amazing faculty, a real jewel in the middle of the Middle East. And I know Johannes is going to make it into something very special. He is the director of cardiac surgery over there. So this is the Methodist Institute for Technology, Innovation, and Education. It's on the 5th floor. It's called Mighty. It's a nice word, Mighty. And that's where the training labs will take place this afternoon. This is one portion of the procedural lab that you'll be in this afternoon. So minimally invasive surgery really started. The first cholecystectomy was done in 1882 by Karl Langebuck, and in 1985, the first laparoscopic cholecystectomy was done in Germany by Dr. Muir, And he was derided by the German Surgical Society, and only a few years later was given its highest surgical award. Laparoscopic surgery has advanced rapidly. We know for sure that there are better outcomes, faster recovery and return to work, and frankly, cardiac surgery is not proceeding in this direction in quite the same pace. So we hope to provide you with the tools to change, hopefully give you some awareness of your capabilities. This is extremely important. Show you how to plan, how to practice, emphasize the importance of teamwork, and very, very importantly, emphasize a culture of safety, and hopefully make what was simply awful into awfully simple again. So I hope you will enjoy the conference, and I'd like Dr. Bonatti to say a few words.
Thank you, Mahesh, for the kind introduction. I would like to give you a warm welcome by the International Society of Minimal Invasive Cardiothoracic Surgery, which I present. I'm serving as the president in the 2016-2017 term. ISMICS is aware of the tremendous value and the importance of hands-on courses like this, and the MIghty here is one of the best, maybe the best facility worldwide, and I would like to thank Mahesh for setting this course up again here in Houston. I think this will be the future. We will have to work on structured concepts also to get people credentialed, privileged for less invasive procedures in heart surgery, just like our colleagues in laparoscopy did early on. Again, welcome. I will tell you a little bit more about our society during lunch break. Enjoy the day. I'm sure it will be exciting.